Fat tissue. We all have it, but did you know that it actually contains cells that can be isolated and then repurposed to regenerate other tissue? Well, here at Laetech, we're developing novel, reconstructive, and cosmetic solutions by harnessing the healing power of a patient's own cells. One problem that affects around half of the US population is that of gum recession, which contributes to some of the 17 million oral surgeries that are annually performed in the US. And this is just a fraction of the 45 million soft tissue surgeries annually performed. The current treatment option is typically autologous grafts in where tissue is cut out of the roof of the mouth, leading to pain and bleeding, the inability to eat, a risk of infection, and of the tissue that can be cut out of the roof of the mouth. It's often insufficient, thus limiting the scope of care that a periodontist or surgeon can even provide to their patient. The other alternative currently on the market are acellular materials. However, these lack cells, leading them to having inferior clinical outcomes, and thus doctors are typically reluctant to even use them, thus explaining why autologous grafts remain the gold standard despite the associated pain and limited tissue. But here at Laetech, we're offering a product which provides the cells which acellular materials lack while not having any of the problems associated with autologous grafts. And after talking to a number of periodontists, maxillofacial surgeons, and patients that have undergone the procedure, we know the demand for the product is high. First, fat tissue is harvested through a needle and then processed down to just the cellular fraction, the process of which is already being performed by many surgeons. The cells are then added to the material, at which point the specific cell populations required to form the needed tissue become attached to the material. The material can then be folded and cut to the desired size by the surgeon and then used as a graft to treat the gum recession. Thus, there'll be no more need for cutting tissue out of the roof of your mouth. And this is all thanks to Laetech's innovation, which is a proprietary functionalized material that will be sold with an optional fat processing kit that could be purchased if the surgeon doesn't already have a system in place. Our customers are hospitals, clinics, and doctors, with the product ultimately being paid for by insurance or patients. Our pricing is competitive with the current costs, which is from $600 to $1,200, and is projected to actually be more cost effective when greater than 4 teeth are being treated, costing around $2,700 compared to the over $3,000. Further, insurance codes already exist for acellular materials and fat harvesting and processing. Laetech's product contains the cells which acellular materials lack while not having a harvest site in the mouth and being able to provide sufficient tissue, unlike autologous grafts, which limit the scope of care that can be provided to patients. We see this product first being adopted into the $72 million US dental membrane graft substitute market. From here, we see ourselves expanding into the global dental grafting market, followed by the even bigger global soft tissue repair market, which is expected to reach $17.2 billion by 2027. Here, we hope to improve the care that can be provided for many situations in which soft tissue repair is needed, such as in breast reconstruction after a mastectomy or lumpectomy, which is another indication that we've been exploring. But to get there, we need your help. With the money from this contest, we'll be able to grow our research team, further validate our MVP in vivo, expand our patent portfolio, and become CGMP and ISO compliant, at which point we'll begin scaling, followed by a first in-human early feasibility study and subsequent pre-market approval in the US, ultimately bringing the product to market and abolishing the unnecessary pain and suffering caused by autologous grafting. Now, the team executing on this is comprised of individuals from the benchtop with expertise in material and gingival tissue engineering, IP, fundraising, and preclinical studies, in addition to the head of plastic surgery at UHN and other key opinion leaders who are the end users at the bedside, who, with your help, we hope to offer a product that doesn't limit the scope of care that a surgeon can provide, allows patients to eat sooner, decreasing the risk of infection, and decreasing the pain and bleeding that patients would otherwise experience, ultimately leading to improved patient well-being. Thank you.